Newsroom. Next week is World Tuberculosis Day, and once again the world will focus attention on one of the top global health challenges. More than 2 billion people, or 1/3 of the world's population, are infected with TB. Research suggests that out of the overall 13 million TB cases in 2013, 9 million were new. Out of these cases, 3 million people were either not diagnosed, not treated, or not officially registered by the national TB programs. This results in many of those people following unknown treatments, infect others, or ending up losing their lives. Now, joining us in Cape Town today is Doctors Without Borders, Dr. Jennifer Hughes, who is quickly becoming one of the world's foremost experts on drug-resistant TB as a result of her work on the disease in Khayelitsha over the past few months. Very good morning to you, Dr. Hughes. Thank you for joining us.
Good morning. Thank you.
TB was once thought to have almost been eradicated in the world, but we see these massive increases, it seems. What do you think are the main reasons behind this?
So TB never really went away. It's a disease which can lie latent in people and can reactivate at any time during a person's lifetime, particularly if they have a dysfunctional immune system, such as when they get diabetes or HIV. And in a place like South Africa, where we have a high incidence of both of those diseases, tuberculosis is becoming more and more of a problem.
The numbers are quite alarming, and we've seen the last few years quite a rise in incidence of new strains. We hear about resistant TB and so forth. Can you explain the difference between normal TB and drug-resistant TB for us, please?
Yeah, so tuberculosis is a disease which most people know. You need treatment for 6 months. You take some tablets every day, and it has a high rate of cure if you complete your treatment course. Whereas drug-resistant TB is the same bacteria, it causes the same disease with the same symptoms, but it's a strain which has become resistant to the two most important drugs that we have to fight tuberculosis. And so with drug-resistant TB, you need a completely different course of treatment. The treatment lasts on average 2 years. You have to take lots of tablets together with an injection every single day, and it has lots of side effects associated with it. A lot of people can't cope with the arduous treatment journey, and so a lot of people default their treatment before the end of 2 years. Not only that, the treatment is really expensive, and it's much less effective than the other treatment that we have for normal TB.
Are drug companies, governments, doing enough to deal with drug-resistant TB? Are we spending enough money?
There has certainly been a lot more interest in recent years in tackling TB and drug-resistant TB, and particularly in South Africa, where the government has really shown commitment to fighting the disease. So not only have they really committed to rolling out a new rapid diagnostic test to allow us to diagnose the treatment quickly, but it's also made some efforts to get people onto treatment more quickly by decentralizing. They have a policy of decentralization where they try and allow people to access their treatment, not just in specialized centers. This could be decentralized even more, so to make it easier for people to go to their local primary care clinic to receive treatment, but at least we're seeing the move in the right direction. In addition to this, the government here in South Africa has also committed to trying to access better drugs for drug-resistant TB.
Now, in a week's time, it will be World Tuberculosis Day. Doctors Without Borders, we're expecting you to release a comprehensive report on the project that you're working on in Khayelitsha. Without going into too much detail, can you just give us an idea what the report would sort of be looking at and what you'll be hoping to achieve with it?
Yes, so there are 3 main messages coming out of our report. The first is that decentralization of services to a primary care level is feasible. We've been doing it over the past at least 5 years, and the Department of Health, the local departments of health, have been working with MSF and have now taken over that program to deliver drug-resistant TB care to people in their local primary care clinic. So we've shown that it is possible, and it increases the number of people who are diagnosed and who can get on treatment. Not only that, but we've also shown that the cost of decentralization, or the cost of treating somebody in a primary care clinic, is nearly half that of sending people to hospital, to specialized hospitals for treatment. In addition, we've shown that it's really, really critical to support our patients through treatment. I've already said how long it is and how difficult it is to complete treatment. And so a lot of patient support is required, psychosocial, financial support, to enable patients to complete their drug-resistant TB treatment and reduce transmission in the community.
Well, I thank you for joining us today. That's Dr. Jennifer Hughes from Doctors Without Borders. She joined us live in Cape Town. We talk about tuberculosis. Next week is World Tuberculosis Day. South Africa is at the forefront of the fight against this disease. Let's have a look.